ankylosing spondylitis, we know that although inflammation is a large part of the disease, there's also other factors that come into play, whether it's fatigue or limits in their function. So by looking at it from all different angles and really trying to optimize the different parts of your lifestyle, whether it be your diet, your sleep, your exercise during the day, we know that that's going to improve different parts of the disease. The main bad habit for patients that have AS is going to be smoking. So I always counsel my patients on stopping smoking if they do smoke, and even if they've tried to quit before and they haven't been successful, I counsel them on the fact that it can take many attempts to successfully quit smoking, and it will make a world of difference in their pain and function. In addition to that, being sedentary is another thing that you want to avoid in ankylosing spondylitis. That's because inactivity actually can cause increased pain and stiffness, so we want patients to stay as active as possible. One of the simplest things you can start doing is walking. That's a great form of exercise. If for some reason that is painful for you, or you're not sure of other things you can do, my best advice is to be referred to a physical therapist. Since ankylosing spondylitis really affects your spine primarily, bad posture can exacerbate the symptoms of it already. So you really want to be very cognizant of your posture, both when you're working during the day, if you are at a desk job sitting and things like that, but then in your day-to-day activity. The best way to go about that is by really strengthening your postural muscles, whether it be through a physical therapy program or on your own, and also making sure that the ergonomics of your situation during the day are as optimized as possible. I would say sleep hygiene is so important for anyone, whether they have AS or not, but especially in AS because we know that fatigue is a large issue with the disease, and sleep hygiene is very important to combat fatigue and tiredness. Usually I start off with asking the patient a little bit about their sleep and where they're having trouble. I also want to know what their sleep environment is like, if it's as optimal as possible with darkness, sound, if they're going to sleep around the same time every night, if they're using phones or TVs before they go to sleep. Things like that are all going to be important in their sleep hygiene and the quality of the sleep that they're getting. In addition to that, the fatigue itself can also be exacerbated by underlying conditions such as depression and anxiety. So I always tell patients if they are feeling a lot of fatigue that they should be evaluated and treated for those conditions. In ankylosing spondylitis, it's a multifactorial disorder based on inflammation, but also affecting different systems in your body. As we know, it can cause stiffness in the joints, it can cause pain, it can cause fatigue. So because of that, we really want to have a multifaceted treatment approach that addresses all of those things. But at the root cause, it's going to be controlling the inflammation from the disease.